again. How are you?
Doing well.
Good?
Good.
Look excellent. You seem to have changed.
Well, I have a little more hair now than when we last met.
And how was that possible? Did you put a wig on?
No, this is all my hair.
Well, how come?
After it was transplanted, it actually grew.
Oh, who did it?
You did.
Did I? Okay. That's a pretty low hairline in my standards. I can't remember. Did I recommend this or did you talk me into doing it lower?
Well,
I frequently design it more conservative than this.
Well, I think I probably talked you into lowering it a little.
Okay, I can tell because. Yeah. Looks natural.
I think it looks good.
Looks good. You have coarse hair.
Yeah.
Well, high caliber at least. How do you rate the result at the donor? Are you happy you chose the strip or what?
Yes.
Or would you rather have FUE?
No. I think the results kind of speak for themselves in terms of the survival rate of the donor.
Okay.
The scar is.
It's maybe a millimeter or two at most.
Yeah, it's very. It's almost.
Your hair is quite short, so even with short hair, it's not visible. Chances are that had we done an FUE procedure at such an extent, there would be much more visible scarring than this one. Obviously received less hairs, but looks natural in the directions. Okay. The problem is in cosmetic surgery, not only hair transplants, we have a saying is that better is the worst enemy of good.
Yes.
And this applies to cosmetic surgery. So and there's people who have multiple cosmetic treatments. See those ladies with the extreme fillers, etc.
Right.
They do it once, they do a good result. They do it twice, and they maybe improve even more. But so they become addicted to having it done rather than forgetting about the actual goal, which was, let's say, a tooth and lip line or something. But then it only requires a few touches to correct it, but then once they do it more, it becomes too much. So if you keep concentrating on hairline, keep lowering it, you're gonna bombard so many donor hairs to do that. One day, and that day may be after I'm retired, if you ask me, can I transplant hairs under your foot? Yes, I can. Should I do it? Definitely not. So when you ask me, can we? Of course we can. But do I believe should we? No. So if you make that angle lower than the mid-frontal point, then you have an inclined hairline, which doesn't exist in nature. So you're gonna make a hairline that's unnatural. But if that was the main goal you came, then I can't prevent it.
No, the main goal is more at the back to thicken the top area, I think. And also, I mean, could probably use a little bit more down into the top as well, as the donor area.
Okay. People always talk, are you going to use single hairs in the hairline? But it's not just about single hairs, it's miniaturized hairs.
Right.
And you don't harvest miniaturized hairs in hair transplants.
Right.
You always get the healthy, thick hair, regardless of being a 1 or 2 or 3 hair.
That's right.
So when you comment, if the patient has coarse hair, you're going to see this kind of.
Your first transplant is going to get you very close to very good results. If you want to perfect those, you're likely going to be looking at a second, if not a third.
There's 2 groups. The majority of the group is, of course, with a more limited budget. They just want a one-shot hair transplant.
Right.
That's all these over-harvested FUE procedures with 5,000, 6,000 attempts. They actually want their donor areas depleted,
right,
because they just want whatever done in that session and never have it done. But that's not real hair restoration in its sense. The real one is that you spend a significantly more amount on that, okay, much less than what you would spend in your own country.
Now, are you going to match the scar line for the new?
Yeah, we will go through the same incision line, but not make any extra. Cut it at different hair lengths. At each length I get different feedback from the hair itself. Now we can get an idea about the future thinning as well. At the full length we couldn't see that, but now we can start at 9 millimeters.
Is it visible at this line?
No, I can't see it at 9. So if you buzz it to 0, you're gonna see whatever you do it.
Right.
So question is the intermediate lengths.
Right. How low?
Like a centimeter or a centimeter and a half.
Right.
I'm not pro any method, I do both, but I think that if you're doing large sessions or multiple sessions, you're cutting at the in-between growth, like a centimeter or a centimeter and a half, donor area may show less with the strip than would the FUE do. And if it's longer, like 2 centimeters or more, then it doesn't matter which one you do. So that's 9. So let me see what happens at 6. Six seems to be doing alright, which is also a surprise. I was expecting to see more. That's 6 millimeter. Okay. Because I can't see it, I need to trim it more. 3 millimeters. 3 millimeters, and now we can see where it is. There. So it seems I'll trim it to an even shorter level, and I'm gonna trim it down to 0. I like to have a tiny bit of hair to see all the directions. I'm gonna leave it like 1 or 2 millimeters.
I'll come to pick you up tomorrow morning.
Okay.
We'll tell you what that is going to be.
Okay.
See you tomorrow.
Thank you, Dr. K.
Have a good
See you.
afternoon.
Bye bye.